So this metagenomic approach is very, very important for identifying not only antibiotic resistance genes, but new functionalities amongst the oral microbiota. Now, not only are these resistant strains a problem for the treatment of oral infections, but the great worry is that they can be transferred to other pathogens in the upper respiratory tract and the gastrointestinal tract. So what pathogens are present in the upper respiratory tract? Most of us will probably think, oh, well, we don't really have many pathogens in our upper respiratory tract. If you look at strep pyogenes, you can see that 5.9% of the adult population carries strep pyogenes in the oropharynx, 3.1% of the nasopharynx. So they're certainly there. Strep pneumoniae, 24% of healthy, symptomless adults carry Streptococcus pneumoniae in the nasopharynx, and 9.2% in the nasal cavity. Strep pneumoniae, a major pathogen. What about Neisseria meningitidis, the deadly killer organism causing meningitis? 7.8% of healthy adults carry this organism in the oropharynx, 4.9% in the nasopharynx. These organisms are quite widespread, and if you have antibiotic-resistant bacteria in the oral cavity, these resistance genes can be transferred to these deadly pathogens. Interestingly, Haemophilus influenzae, which is an important causative agent of a lot of upper respiratory tract infections, 31% of individuals harbour it in the oropharynx, 23% in the nasopharynx. Staphylococcus aureus, we all think that Staphylococcus aureus is a skin organism. Staphylococcus aureus is not a skin organism. Staphylococcus aureus is a respiratory organism. It's found on the skin accidentally and incidentally by transfer. The primary colonizing site of Staph aureus is the anterior nares, so it's part of the respiratory tract. And surprisingly, perhaps to many people, 22% of people carry it in the nasopharynx, 18% in the oropharynx, and 26% in the nasal cavity. So here we have Staph aureus sitting waiting there, and if you've got a gob full of antibiotic-resistant organisms which can interact with these other organisms, and these are pretty hostile, deadly pathogens. So it's a cause of great concern.